Good afternoon. This is Michele Courton Brown from Quality Interactions. Delighted that you've joined us for today's session where we're talking about vaccines. I'm going to apologize in advance. My camera's not working. Welcome to Zoom land. But we do have Dr. Joseph Betancourt on camera, who's our featured presenter today. So Joe is Senior Vice President of Health Equity, a Chief Health Equity Officer at Mass General Hospital, also co-founder of Quality Interactions. And you have been, Joe, in the thick of things. So I want to welcome you, but I also want to just check in to see how things are going.
Great. Thanks so much, Michele. I'm sorry I can't see you, but it's great to have you, and it's great to have everyone. I appreciate everyone logging in. I know these are busy times. So I'd say a couple of things. First, before we begin, I want to acknowledge, the events of this week and just the incredible amount of, anti-Asian racism we've seen in this country, escalating over the last year, and just another tragedy this week. And it just so just a moment of reflection there for what we've experienced, and just again our need to stand up for equity, for justice, and for equality. So just a moment of reflection for that loss, and hope that we can be more humane as a nation, and be more caring as a nation, and really shed all the negativity and division. I just hope the hangover doesn't last too long, and I think it definitely lasted into this week. So before I begin, I just wanted to say that. So it's interesting, Michele. It's been a year and 3 days since I started leading Mass General Brigham's Equity and Community Health COVID workstream with my colleagues here. And ultimately, I think this has been an incredible journey. I've had a chance to share some of my thoughts and reflections with many of you who've been on these presentations, and I appreciate that. I think if I were to give an update of where we are right now, I'd say that there's no doubt that certainly in our state and across the country, we have seen a decrease in our infection rate, a decrease in our hospitalization, a decrease in our death rate, which is all very, very positive, and it gives us a strong sense of a light at the end of the tunnel, particularly now that we've started vaccination. I'd say though that there is, not insignificant concern about the variants, and the variants that we're seeing, particularly in Europe right now, and in South America. It's very concerning. I mean, the right before we started our work stream, Italy was the shoe to drop right before us, and to see what they've had to do with lockdowns is just is very concerning. So I think it's a tenuous time, but I'll tell you, I mean, I can't even bring myself, and I think I speak for many people in healthcare, I can't even bring myself to think about what another surge would look like. The amount of burnout is so extensive that this idea of kind of gearing up again, we've stood down a lot of our efforts. And so I think there's a concern, but the good news is that vaccination is starting, so all the more reason why we're in this race against the variants with vaccine. But very tenuous, delicate, but hopefully we can get through this.
Yeah, it's this funny period where it feels like we can almost see the light at the end of the road, but not fully yet, right? We're at 12% vaccination rate, I think. Vaccines are underway around the country, but we've also heard a lot about the lack of equity in the distribution and access to vaccine. What's the story there?
Yeah, it's been a big issue, and I think right from the start, when vaccine became available in December, it did become kind of a Hunger Games for vaccine, right? Everybody was trying to get vaccinated, and I think the sad part is that where we sit here today, if you were to look at any major metropolitan area or any state and put a map up and look at infection rate versus vaccination rate, instead of the science, which would say that these should overlap, instead what you see are almost mirror images, not in a good way, meaning infection rate on this side, vaccination rate of the map on this side. And that means that clearly those who are lower risk, who have lower infection rate, are getting more vaccines. And it absolutely is an issue of communities of color not having vaccine and vaccination rates as high as they should, especially given the science would say that for these communities, the deployment of vaccine is an absolute imperative
Yes.
because at the end of the day, their risk has not gone down. I'd say their risk has gone up as we are reopening more. And they remain the essential workers. And I was hoping that as a nation we would have the dignity of really prioritizing these communities and these individuals who really allowed us to do so much from home, right? Who delivered our groceries, who stocked our grocery stores, who did all these incredible things for us. And we haven't done that as well as we should. And so it's a national story. We certainly see it here locally. It's a major issue.
Mhm.
And, it's very disappointing. I'd say after being in the fight, I'd say two things. After being in the fight for this long, it's disappointing. And after all the dialogue around, equity and justice over the summer, um, to have our first test be equity and vaccination and us failing that test is been disappointing.
Disappointing indeed. So why do you think we're seeing this?
It's a great question. I mean, I think that there's a lot of factors here. And one of the big factors is the importance for speed, right? So fundamentally, from a public health standpoint, we understand the importance of getting needles in arms, as I mentioned. But what's transpired, unfortunately, is that there's been this effort to do these mass vaccination sites, which makes sense. But to me, from an equitable standpoint, they only make sense if they exist and a counterpart exists in a vulnerable community, or if they exist and there's good vaccine supply in vulnerable communities, not at the expense of vaccine supply in vulnerable communities. And unfortunately, that's what we've seen. So we've seen mass vac sites that, quite frankly, aren't always accessible, are, quite frankly, not often in hotspots. I think that's become a problem nationally as well. And not easy to access just from a technological standpoint to get an appointment. That's a whole, another set of issues. And so I think it's and certainly I'd say here in our state in Massachusetts, we, we were kind of moving along, and there was a sense that we were lagging behind in our national numbers, and they really pushed the mass vaccination sites. And again, I understand that, but you need to have a balanced strategy. And I think we can't overlook the fact that, communities with more political power, with greater socioeconomic clout, I think have had greater access. It's sad, but it's, maybe to some degree not unexpected when we think about healthcare in the U.S. Though, the haves have advantages, and it is certainly played out as it relates to this effort around vaccination and equity.
Absolutely. We know it's interesting that you raised this issue of sacrificing equity for speed, because there's been a lot of talk about vaccine hesitancy, and I just wonder whether people are putting the right attribution of blame around vaccine hesitancy as the reason why
Yeah,
people are not getting shots in the arms.
yeah. Look, there's no doubt that we knew coming into the pandemic through surveys and through common sense that communities of color were not against the vaccine, but what surveys were showing is they didn't want to be first. They wanted to kind of see how this played out. So not me first. We also saw a lot of misinformation out, through social media and the like, that created a lot of doubt and I think fomented mistrust that is longstanding, historic, based on our nation's history of racism, segregation, medical experimentation, and the like, and mistrust for healthcare. So there's no doubt. I'd raise an interesting point. If you looked at some of the data this week, it should be noted that this is not, this hesitancy or lack of confidence in the vaccine is not just a community of color thing.
Right.
A very large group that's quite vaccine hesitant in recent surveys has been, Republican men. So this has been politicized as well. So I'd say, the politicization of the vaccine, in addition to mistrust, has led two very different groups to be very, very hesitant. And the reason I raised that other group is because many people, I think, have aimed to make vaccine hesitancy a people of color thing. And it's not just a people of color thing. And ultimately, it should not be an excuse for not having more equity. I think that's really critical. So when we look at our numbers and we see we're lagging behind, many people have wanted to say, oh, it's vaccine hesitancy. But fundamentally, we need to understand that there's a lot of key ingredients that are essential to achieving equity in vaccination rates that go above and beyond the very important component of addressing vaccine hesitancy.
Yeah, that is interesting. So what do you think are the key ingredients for vaccine equity?
Yeah, I think we need to understand that if we are to achieve vaccine equity, this is a kind of not a multi-legged stool, it's a multi-legged table. And so these are the key ingredients that in fact we've been trying to operationalize here in the Mass General Brigham system, and many have across the country. But I would say number one, making sure that you are carving out supply and prioritizing vulnerable communities through your phasing of reaching out to patients to get vaccination, right?
Mm-hmm.
So that's really critical. You need to make sure that you are, this shouldn't be just first come, first serve. We understand that for certain groups, it's more difficult to get that access. And for certain groups that I mentioned before who still are high risk, we should get them vaccine first. So for example, one key component is how do we assure that we're weighting and prioritizing community of color? So one key component, one key leg of the table is as you go through each of your phases, you should be able to identify patients who live in hotspot communities driven by infection rate or social vulnerability index, and they should be called first in each phase. That's one. Number two, you need to have vaccine proximal to people. So as I mentioned, these vaccine sites are not accessible, they're not easy. So putting vaccine in community-based sites, proximity is the second key leg of the table. So whether it be mobile, whether it be delivering it, to community-based organizations, but proximity is really critical. That's the second. I'd say third, people in the community need to know how to get the vaccine. So just the vaccine's available and how do you schedule? And that scheduling needs to be, that process needs to be done in a way that addresses the digital divide.
Yep.
It needs to be done in a way that's multilingual. It needs to be done in a way that, if you have immigration concerns, you're not necessarily asking for IDs when you are giving, putting out notices for giving the vaccine. It needs to be clear around cost issues and saying there's no cost. That awareness also needs to address individuals with disabilities. How do we make sure that they understand? And it needs to kind of make sure that everybody is aware this is where vaccine is, and this is how you can get it. That's leg 3 of the table. Leg 4 of the table is anybody who wants to get vaccinated, you have to make it easy for them. It cannot just be an app on the phone. I think many states have done a good job of creating inbound call lines, so multilingual. So the simpler you make it, the better it's going to be. And I think we've seen, certain states even use creative strategies with navigators in community, literally knocking on doors and signing people up. So that low tech, high touch is a fourth and very critical leg of that table in how you facilitate scheduling for people. And I'd say the fifth leg of the table is the addressing lack of confidence in the vaccine. And so fundamentally, we need to understand that, yes, for all the reasons that I stated, people are concerned. And I think the good news is we are seeing trending in the right direction, meaning people are becoming more comfortable. We do believe that if we make vaccine available and address those other 4 legs, that hesitancy shouldn't be the only barrier. But certainly around the hesitancy work, we've done a lot in that area. We've created, for example, here a roster of trusted messengers, caregivers of color, who would do 4 things. This roster is deployed to do multicultural media in multiple languages. So we're on the channels, we're on the radio where people could see us. Number 2, we have availed ourselves to community-based organizations, faith-based organizations, other local and national organizations who need a caregiver of color to talk to people as part of any town halls, telephonic or Zoom or otherwise. We will be starting next week Facebook Live conversations between caregivers of color around vaccine hesitancy in multiple languages. And then finally, one of the things I'm proudest of is we started a mobile effort. We call it our community messenger effort. It's literally a mobile van that we've set up. It's called a community messenger van. We work with community health leaders. We tell them we want to be in community. They identify spots for us. We'll go park and literally be there for 3 hours. We have care kits that we give out with masks and sanitizer. And as people come up, we say, hey, have you thought about getting the vaccine? And we kind of have conversations with them about it. So I think the addressing vaccine hesitancy becomes that fifth leg of that table. That's so those are the ingredients: supply set aside and prioritization, community-based, increasing awareness, facilitates scheduling, and addressing hesitancy. To me, are the key ingredients of this of vaccine equity.
That is pure gold, Joe. That is pure gold. I wonder if you might also share with us. I think that lots of people don't know what the conversation feels like with someone who is vaccine hesitant. And I wonder if you might give some insight to some of the experiences you've had.
Yeah, it's a great question, and I've engaged in a lot of these in both virtual and in the streets. And so let me just begin by saying that we get a lot of common questions, right? Does the vaccine, there's concerns around side effects, there's concerns about, can the vaccine give me COVID? There's concerns about fertility, allergies. I have these conditions, an autoimmune condition, is it okay? So I think we have a lot of those basic questions that are quite universal that we're addressing constantly. But I would say a couple things. I have fundamentally leveraged a lot of the things that we've taught through quality interactions that I've learned, that I've had the privilege of learning and teaching over the years, that are absolutely quintessential for this effort. And so when I approach a conversation around vaccine hesitancy, this isn't about scolding, this isn't about shaming, this is about the first thing I need to know is I throw an open-ended question: have you thought about getting the vaccine? Right? It's almost like the two tools I try to leverage are motivational interviewing, which is how do you move people forward on stages of change towards actualization, but also kind of these cross-cultural skills. And so I begin with a very open-ended question: have you thought about it? And if they say, I don't want it, I haven't thought about it, then the key part of this process is getting at their explanatory model, their understanding of the vaccine. And so one tool we teach is, what are you most worried about? We've developed, as the ESFT tool, which is explanatory model, social risk, fears and concerns, and then kind of the negotiation, right? So I really use that. So I'll say, what are you most worried about? Could you get it if you want to get it? Do you have any particular fears and concerns? So I walk through this process with them to work from their model and kind of go from there. I could certainly sit here and do a lot of education. This is an mRNA vaccine. This is that vaccine. I try to do less talking, more listening, and negotiate with them to try to titrate, the cross-cultural negotiation we teach, titrate it to the pieces that they share with me, and acknowledging I could understand why you're mistrustful. I fully understand that. Let me explain to you what we've done to make sure that you could trust this vaccine. It's been tested more than any other vaccine, more diversity than any other therapeutic or medication in the nation's history. So I kind of walk through. So when it relates to mistrust, it's identifying mistrust as we teach, and building trust and securing and kind of building reassurance. When it comes to, well, I'm afraid of, it's hearing that out and then negotiating that, and then it's really just kind of moving people along the kind of motivational interviewing stage of change. And sometimes I'll get a chance, they'll come back the next week and we'll talk some more. And I'm thinking about it some more. And hey, I want to get it. Where can I get it? So you want to move people along that continuum. I will say, I'll end here, Michele, by saying that I have found that there are a lot more people who want to get the vaccine and are asking me, where do I get it, than people who say, I'm really hesitant, I don't want to get it. And so there's a bit of a stereotype breaker here. And again, we shouldn't use vaccine hesitancy as a reason for not having vaccine equity. So I think those are important. And I would say that everybody on this call plays a role in this. These are conversations we have with our friends, with our neighbors, with our coworkers. with people, with vulnerable communities. That model that allows us to kind of get at the individual, the person's understanding, their explanatory model, engage in cross-cultural negotiation, and build trust,
Hmm.
and also provide facts. What we know about allergies, which have been very, very low. Sprinkling facts in there, of course, as part of
Right.
that dialogue, are all critical. Those are all critical parts. Yeah.
So, Joe, what you describe is a marathon, not a sprint. This is going to be a long journey. And this one vaccine that we're all hopefully getting in 2021 will not be the last vaccine we'll take for COVID. We'll probably have to take these vaccines every year or have some sort of refresh. Um, any insights, any parting thoughts about how we engage in this conversation and keep this momentum going?
Yeah, absolutely. And I want to weave in. We got some questions that I like to weave them in. One was around overcoming vaccine hesitancy, and I think mistrust. They talked about mistrust of the government, and I think one of the questions, and mistrust could exist for healthcare, for the government, for a lot of different things. And I think when we try to talk about, this is, we in healthcare, and myself as a trusted messenger have reviewed the science. So you may not trust a lot of things or situations or institutions, but I'm hoping you can trust me, which is one of the key tools we teach. Another part of this journey certainly is that we're all partners here. So there was a question that was submitted about how can health plans support equitable vaccine efforts. I think resources certainly help to support, any and all these efforts, leveraging, the five kind of key ingredients that I've talked about. How might you as a health plan invest in communication strategies that increase awareness? How might you deploy, people who are perhaps off the shelf right now, to help out with facilitating scheduling as ambassadors or navigators? How might you as a health plan leverage your advocacy to make sure that vaccine is in vulnerable communities? So I think there's a lot of ways that health plans can play a major role here, and they're doing it, in fact, locally and nationally. And so I would say, think about those five key ingredients that I've mentioned. Obviously, you're not in the prioritization game, but really assisting with community-based efforts, facilitating awareness, facilitating scheduling, and supporting efforts that address hesitancy are all opportunities for health plans. There's a question here about the digital divide, and I think I mentioned this in my earlier comments that we can't just depend on an app on the phone. We know how difficult that is. It's incredibly challenging, and so fundamentally, high touch, low tech, that ranges from a simple call in line that's multilingual to knocking on doors, ambassadors or navigators in the parking lot of supermarkets who could help people get scheduled. Like any and all strategies I think need to be implemented that address the digital divide, because the going digital alone will not get us equity. I've talked a bit about trust, and there was a question about trust here. So I think we've covered a lot of the key questions that have come in. So I'd say the parting thoughts here are this: we are in a phase right now where we are grinding, we're kind of building things out. What we understand is that those individuals who are waiting for others to get it, that big group is still to come. So we cannot take our foot off the gas. The people who are getting vaccine clearly are those who are more digitally connected, more savvy, able to go to the mass vac sites. So our work around equity, we might get big vaccination numbers nationally. Our work around equity, as always, and unfortunately, will lag, and we cannot slow down in the months to come. And I'll just say, we've seen it here, even with our employees, as we track our employee vaccination rate. Very early on, our white rate was quite high, and there were gaps among our Latino and Black colleagues. Those gaps are narrowing, but they still exist. We are not taking our foot off that gas. That, to me, what we've done with our employees has been a bit of a microcosm of what we're going to see in society, which is for us in equity, the game doesn't end on July 4th, to be honest, when our president said it does. It's probably going to go into the summer, but we need to continue to let people know what's at stake. We're at race with the variants, and if you want to get back to normal, this is the path. And leverage people who've gotten the vaccine to really just share that experience with each other. So I wish everybody good luck, and I think more than anything else, I ask and we need your engagement around all these equity efforts. And hopefully those key ingredients, some of those cross-cultural skills that we have spent a lot of years teaching, this is the time to deploy them now more than ever before. So I'm hoping that everybody, could find their pearl in some of the things that I've humbly shared today.
What a wonderful way to conclude our conversation. Dr. Betancourt, thank you again for participating in the session, and thank you who've attended. We'll look forward to the next time we have a chance to connect. Have a great day.
Thank you all so much for being here today. Bye-bye. Good luck.